Lily, thank you. Recent studies have found a link between cooking with gas stoves and worsening asthma symptoms in children. And scientists say drinking soda could cause some of you to start losing your hair. Well, we're learning about these new reports this morning with our medical correspondent, Dr. Hebert. Thank you so much for being with us. Okay, let's start with gas stoves.
Okay, because I thought you were looking at me about losing my hair.
Oh my gosh, no!
Oh, okay.
Hey, listen, my hair is so thin, I don't have any room to talk about anything. And I drink sugary drinks, so now I'm like, uh-oh.
Yeah. So basically
Mm.
what we've seen here is that we looked at 1,000 men in China, right?
Okay.
So what it looked at is how many sugary drinks that they drank, but not just sugary drinks that also had caffeine. So let's look at these. It's like Monster and all these energy drinks, right?
Oh.
And it looked at them over a 4-month period. And what it looked at, it actually saw 42% of these men had a decrease in hair growth and an increase in hair loss. Even with one soda per day could increase this risk, but it was a higher risk if you had these caffeine drinks, these energy drinks. So if you're out there and you're drinking 2 or 3 of these a day, you are going to probably have an increased risk of hair loss. Now, it's not a big deal because it's not a health issue as far as the hair loss, but it is a health issue when you start looking at the fact that you will become overweight. We know that sodas are linked to other comorbidities like hypertension, diabetes, and early death. So what you should do is just stop drinking all the sugary drinks. And really, if you need to have some caffeine or some more energy, go to sleep earlier. Just try for me. Go to sleep early.
Some of us can't.
7 hours. No, you have to get up early, but that doesn't mean you can't go to sleep earlier.
You can come watch my toddlers.
There you go. Oh, yeah, there you go. Okay. So
why was this just men? I need to know for what it means for women.
Yeah, well, we haven't done that study yet.
Okay.
But it's coming because the issue is that what is the mechanism that's driving this, and we're not really sure yet, but it does exist, and the link is there, so we have to kind of take it seriously.
Okay, let's go back to the gas stoves because I know last week when this came out, a lot of people were like, "Wait a second,
Yeah.
is that true? The
No,
gas stoves and asthma."
Okay, this is a big deal because this last week was pretty controversial, like with this past study and then with this one. Okay, so it's the International Journal of Environmental Research said that if you have a gas stove in your house and you have children there, it's 13% of the asthma cases in the United States are attributed to these gas stoves.
Wow.
However, in 2009, I did some research back in the day, and it actually in the Journal of Allergy Immunology in the Clinics of North America, it actually said that it was inconclusive that gas stoves did this. So what I will tell you is don't go throw your Viking out just that quickly. What I do want you to remember though is that the things that you can control them. Don't smoke around your kids. All right. Make sure that you put a plastic cover over your the pillows and the mattresses, and make sure that you can decrease the dust mites that way. If you have carpet, pull it up. Use wood or tile, because those are the things that we can control. Is it possible that a volatile organic compound like gas in the home could be contributing to the asthma? Sure. I mean, I think that this is possible, but that's not going to change right now because there's too many gas stoves in America. So let's start working on things that we can control.
No, okay, I love that.
Yeah.
All right, now there's a diet supplement that can help constant UTIs.
Yes. Now this is one. Once again, this is I'm in the grocery store, and people come to me all the time, ask me questions. And this lady came to me. She was like, "Look, I'm having UTIs all the time, and I try this thing called D-mannose. D-mannose. It's naturally found in fruit, and it's marketed as a dietary supplement. But the studies are now showing that you can actually reduce recurrent UTIs and improve your UTI, your urinary life rather, if you take D-mannose. Now, it is not a treatment for UTIs. I want to be very clear. If you have recurrent UTIs, you got to talk to your doctor, okay? But if you get the D-mannose, the studies are showing that if you take it when you start having the first symptoms, it can prevent that UTI. And the important part is that it's like sugar, so it's in the UTI tract. And so what happens is it stops the E. coli from binding, and so that's why you don't get the urinary tract infections. It is a supplement. It is not a medicine. I want to stress that.
Okay.
But the point is that We have a lot of data out there suggesting that this actually works, and some of the big urologic organizations are also recommending this now. So if you get UTIs all the time, try D-mannose. It's just a sugar; it can't hurt you.
And there's a lot of people out there who get those all the time.
All the time.
You're not recommending take one every day, just when you first get that first symptom.
Correct.
Okay.
And if you actually have recurrent UTIs, start trying to take it maybe once or twice a week to try to keep things under control, and then get to your doctor so you can figure out what's the real reason that you're having this. And we also want to have good hygiene, and that's really important as well.
Okay, thank you so much.
Thank you. It's a very controversial week with all this stuff.
Dr. Hebert visits every Tuesday on the Eyewitness Morning News. If you have missed any previous updates, you can find them on our app, YouTube page, and our website, wwltv.com.